I'm Tom Galperin, and I appreciate the invitation to be here today. And I'm going to talk about developmental disability, executive functioning, and mental health, and sort of how they all can come together and interact with one another. And I've sort of titled this, the intersection of DD, executive functioning, and mental health. I do need to share disclosures. The only disclosure that I have is that, yes, I'm being compensated for providing this presentation. Diane gave a quick introduction, but this is a little bit more about me for folks who may not know me. I have been in the autism and developmental disability field for 25 years now. I actually got my start in supported employment. I was helping people find jobs and then helping them keep their jobs and do well on their jobs. I worked in supported employment for about 8 years, and then I have worked in a wide variety of places doing supports like in people's homes and then in the community. I have worked in a behavioral crisis unit at a developmental center. I've done a lot of training and education for both parents and professionals. A number of years ago, I started doing mental health counseling for folks who were on the autism spectrum. And then over the last year and a half or so, when I started my private practice, I'm still doing counseling for folks who are on the autism spectrum, but I'm also doing counseling for folks with other developmental disabilities as well. I also do consultation to agencies and school systems. And I have worked over the years, I have worked with kids as young as 2 and adults as old as 70. And I have supported people with a wide variety of cognitive abilities. I've supported a lot of people who are far, far smarter than me and have genius level IQ. And I have worked with folks whose IQ is in the moderate ID range, ID being intellectual disability. And then everywhere in between. And I spent 18 years of my career in North Carolina, and then the last 7 or so here in Cincinnati. So I'm going to be talking about developmental disability. I'm going to be talking about executive functioning, and I'm going to be talking about mental health. So I want to take just a quick minute to talk about the definition of what those things are and how they differ from one another. For some of you, this may be review. Some of it, for some of you, it may not be. I'm not going to sit here and go through all the technical stuff, but the highlight of sort of the definition of developmental disability is that there's that impairment that's not caused by mental health that happens before the age of 22. Now, different states do have different language and slightly different rules and laws about what qualifies as a developmental disability. The ones you see on your screen are the ones for Ohio. They're all extremely similar across states, but there may be some slight differences here and there. But the main points are that it is likely to continue indefinitely. It's not something that technically you recover from. And in order to get that developmental disability label, you have to have what they call a functional limitation in at least 3 of those things that you see on your screen: self-care, language learning, mobility, self-direction, and capacity for independent living. And then if you're over 16, the capacity for economic self-sufficiency. And again, those are things that you have before the age of 22 and it's likely to continue indefinitely. Then I want to look at the definition of executive functioning. And this is like when I Googled executive functioning, this was like the dictionary or the internet definition. And I'll be honest, I don't know what that means. So I put that up there because I wanted to sort of show what, if you Google it, what you will get. And then here in a little bit, I'm going to break that down and try to make it a whole lot simpler in terms that people can understand. But I did want people just to be able to see that. Then we're going to talk about the definition of mental health. And I think, again, the important distinction for mental health versus a developmental disability is that mental health does have that capacity for quote unquote recovery. It's not necessarily a lifelong thing. It does not have to have started before the age of 22. And there is that chance for recovery. And so that is different than a developmental disability. There have been plenty of people who have talked about how trying to sort of differentiate those two, and maybe aren't they more related than what we have traditionally thought? And maybe the answer is yes, maybe not. But I think just for today's purposes, trying to make sure that we've got a clear definition of what a developmental disability is versus what mental health is. Okay, so going back to executive functioning. So in the top left corner, you'll see it's kind of grayed out. This was the Merriam-Webster dictionary definition of executive functioning: the group of complex mental processes and cognitive abilities that control skills required for goal-directed behavior. And as I said, I don't know what that means. I can't figure out quite what that is. So what I wanted to do was try and take that and let's try and put it in easier to understand and plainer language, and then talk about how that really affects folks. So if you look at what executive functioning really does, if you really want to make it super simple, it makes you or allows you to stop, think, plan, and then do. And that's a very oversimplified explanation, but at the same time, it's probably the most accurate. Executive functions make it possible for you to be able to take an idea, stop, think about it, play around with it, and then do something with it. It allows you to take the time to think before you act. It allows you to kind of deal with either new challenges or unanticipated challenges, surprises, changes. It inhibits your impulse control. So resisting temptation is something that executive functioning allows you to do. And it also helps you stay focused. And so we're going to go into some more specific examples of what executive functioning does. But I felt like, and I'm hoping this makes sense to you all too, that it when you break it down, it really does help you stop, think, plan, and then do. Okay. And if you think about throughout your entire day, from the time your alarm goes off in the morning until the time that you go to bed at night, if you think about all the things that you have to do that require you to stop, think, plan, and do, it's a lot. It's a whole lot. I think for people who don't have executive functioning deficits, that ability to stop, think, plan, do, for a lot of folks, it's automatic. They don't have to take the mental energy to make sure that they do that. They just do it. For a person who does have executive functioning deficits, it requires a tremendous amount of effort to be able to do that. And it requires some accommodations to be able to do that. And later on, I'll talk more about sort of what those accommodations might look at. Okay. One thing I forgot to mention, if people do have questions, it's totally okay to stop and ask, or if you want to put them in the chat. I don't have the chat thing up. So if you see ones that come in, will you interrupt me and let me know if there are questions that are coming in through the chat?
Yes, I'll do that.
Okay. All right, thanks. Okay. So when we talked about sort of what executive functioning really does, and it allows you to stop, think, plan, and do, that's organization. And I think these two pictures do a pretty good job of giving a snapshot into what organization looks like and what disorganization looks like. And I think what a lot of people who have chronic disorganization will tell you is that they can't arrange the time and space elements in life. And again, if you really stop to think about everything that you do in a day, from the time your alarm goes off to the time you go to bed, how often or how much do you have to be able to arrange the time and space elements in your life? And the answer is it's constant, right? So if you have chronic disorganization or you have an executive functioning deficit that makes it hard for you to stay organized, how hard is it for you to be able to successfully navigate your day? Whether that's socially, whether that's at work. And we'll talk about some examples of that here in a little bit. But I think the point is it can be very, very difficult. Another core thing of executive functioning is planning. And by planning, I am talking about things like the who, when, where, what, how, why, right? So again, from the time you get up in the morning, planning out where are you going to be, like where are you going? You're going, like you got to go to work that day, and then on the way home, you got to stop at the bank, and then you got to stop at the grocery store, and you got to get this, and this, and then you're coming home, and you're doing laundry, and you're doing this. You're talking about planning out sort of all the details of your day, and not just sort of where you're going to be, but when you're going to be there, and what you're going to be doing when you're there, and who are you going to be doing it with. And so I think just being able to sort of plan when you have an executive functioning deficit can be difficult. For some folks, maybe planning out your day is not so bad. That you could probably do. For some folks, it may be, but trying to plan out a week, that may be a lot harder. But then there are going to be plenty of other people who are going to have a hard time planning on just like getting up and getting to work, and just planning that out may be difficult. Okay. And we're going to talk more about this later, but if you start thinking about these deficits and what they mean, it can mean a lot of frustration. It can mean stress. It can mean failure, and what that does to your mental health, right? It can be taxing. Okay. Sequencing is another part of organization and a part of executive functioning. And sequencing meaning doing things in a certain order, right? So I have two kids. I have a 10-year-old and a 7-year-old. And my 7-year-old is getting ready to go through the process of getting testing for ADHD. And I'm pretty confident that he's got ADHD. We don't have he hasn't been tested yet, but I'm pretty confident. And one of the things that I've noticed with him is he really struggles with sequencing. And one of the prime examples is getting dressed in the morning. He really struggles with getting dressed in the morning. And it isn't because he doesn't know that he's supposed to put on a shirt and pants and socks and underwear and shoes. Like it's not the fact that he doesn't know what to wear, because he knows what to wear. It has to do with the order in which he puts it on. And I have watched him go into his room where his clothes, they used to be laid out. He can get them out now on his own. But even if they were laid out, he would be in his jammies and he would go in, and I would see like he might take off his pajama shirt, and then he would put on the pants that were laid out over top of his pajama pants. And then he would start like putting on socks. And I would go in there and I'm like, buddy, what are you doing? He's like, getting dressed. I'm like, can you look at what you got on? And so he sort of looks around, like, what are you talking about? Like, but you got to take your pajama pants off before you put your other pants on. And he looks and he's like, oh yeah. But it never occurred to him when he was going in to get dressed. He knew exactly what he was supposed to do, but he didn't have that sequential order of what should I do first? What should I do second? What should I do third? And what ends up happening is, of course, is that slows him way down, because he's got to then undo part of what he's already done in order to get to the end of getting dressed. So that's just a very simplified example of how executive functioning deficits can interfere with your ability to do things in an order that is productive. And if you don't, again, you may be doing the right things, but you may not necessarily be doing them in the right order. Okay. Do you think about that can happen at home? That could happen with cooking. That could happen with cleaning. That could happen at work, with having certain responsibilities that you have to do. But if you do them in the wrong order, you may end up having to break down, tear apart, get rid of half of what you've done and start over because you did it in the wrong order. Okay. Then another part of executive functioning is initiation. It is that ability to start. And I think there's a number of reasons why initiation is tough. I think some of it is, for some people, it is the stopping of one thing and understanding that thing is done and over and finished, and that it's time to start the next thing, and sort of switching focus from one thing to another. And for other people, I think it's not that. They do understand, like, when one thing ends and another thing begins, but they can't get their brain and their body to take that first step and get going. And oftentimes, I think people recognize that they can't. They know exactly what they're supposed to do. They can tell you exactly what they're supposed to do, but they can't initiate it. And I think You think, again, I think about the things that you need to do in your life that you can't do because you can't initiate it. How is that going to make you feel? And could that lead to getting down on yourself, feeling negatively about yourself? And the answer, of course, is yeah, it certainly could. If you are, trying to call some place to be able to get access to certain services that you need, but you know you need to do it. You know the phone number of the place to call. You know the name of the person that you're supposed to ask for. You know what services you're going to be requesting, but you can't quite seem to find a way to get that phone call started. And then what happens? You don't get access to the things that you need to get access to. And it's because you couldn't get it going. Okay. Okay. I think, and I've already talked about some of this, but initiation of many things can be hard. So it can be a task. It can be like in the initiation of doing your laundry. It can be, in fact, even the planning of things that you know you need to plan for. So if you know you need to do laundry and dishes and work on something for work that day, you might get into the routine of knowing, like, okay, I need to plan ahead to be able to do all those things. But then you can't get started on the planning to be able to get those things done. And again, I think that can be very, very frustrating because the intent is there, the desire is there, but you hit that roadblock, and how that can affect your mental health. I think also, initiation of social activities, those can be anxiety producing. You want to call up your friend, you want to go out to dinner, you want to go to a movie, maybe just want to call and chat, but you can't quite seem to find a way to initiate doing it. And then if you're not having social interactions the way that you really want to have them, can that lead to, again, negative feelings about yourself, negative self-esteem, depression symptoms? And yes, it definitely can. And along the same line, same thing with communication. I was just talking about that. So initiation can affect a lot of things. Another core thing in executive functioning is time management. And this sort of goes without saying, to be honest. If you're having trouble with initiation, if you're having trouble with sequencing, if you're having trouble with prioritizing, which we haven't talked about yet, how is it going to affect your ability to manage your time? And the answer is a lot, significantly. Time management is tough for people with executive functioning deficits. And again, time management really, that goes across the board, across environments, home, work, play, whatever. Time management can be really, really tough. And we will talk in a little bit, we will talk about some things, some strategies that you can use in order to be able to help with time management. Okay. Another core thing that executive functioning does is it helps with working memory. And here's what working memory is. You are thinking about something, okay, and you access a certain part of your brain and you grab a piece of information from it. And then you sort of pull it into what they call working memory and you hold it there. And then you access this other part of your brain and you grab this piece of information and you pull it in to working memory. And now you've got these two things in there. And then you grab this other thing from this other part of your brain and you pull it in. And now you got three things in working memory. And your brain is supposed to be able to hold those three things in there and keep them organized and combine them and think about them and process them. So we all do this, and we do it without ever realizing we're doing it, and we do it constantly. But if you have an executive functioning deficit and you have a deficit in working memory, and your brain pulls this piece of information from over here and this piece of information from over here, and then it goes to pull this other piece of information, and as it's pulling it down, the other two go away. And how are you supposed to be able to process the information when it's supposed to be there, but it's already gone? And that gets really, really hard. And again, gets really, really frustrating. Again, we all use our working memory all the time, way more than we ever even realize. But for folks who have troubles with it, again, it can make sometimes even what many people would say are relatively simple tasks, it can make it difficult. Because you're then constantly having to spend time and mental energy going back and getting that piece of information that you had, but you lost it. And then you're going back and getting this other piece and you're bringing it back that you had lost, but then you've lost the original thing you had. And so you're constantly almost like chasing your tail. And that takes a tremendous amount of mental energy. And oftentimes it results in frustration, anxiety, confusion. So that's working memory. There's also flexible thinking. So executive functioning does allow you to think about things in more than one way. Another term that's often used along with this is if you have inflexible thinking, some people might refer to that as concrete thinking, meaning things are either black or they're white, and there's no gray in between. So it's either or. Or once something has been thought of in a certain way, that's the way it's always going to be thought of. And trying to deviate from that can be tough. So executive functioning allows you to be able to have flexible thinking. The world that we all live in, when you really look at it, the number of things that are truly concrete, or the number of things that are truly either black or white, it's actually very small. Most of the world operates somewhere in the gray. But if you have trouble thinking in the gray, how is that going to affect your ability to function? And it has affected a lot. Okay. Somebody who has inflexible thinking might look at this picture and think, oh, that's what you mean by flexible thinking, is that person is physically flexible. But that's not what we're talking about. We're talking about being mentally flexible. And a person who has inflexible thinking might have a hard time understanding that concept because they've seen this picture of this person being flexible and think we're talking about physical flexibility and not mental. Executive functioning also affects our ability to do self-control, impulse control, emotional control, monitoring yourself. Okay? So this can be things like, to use a really simple example is, so I have impulse control problems. And I think that there are times when I don't think things through. I just do. And then after it's like, oh man, why did I do that? And that's an executive functioning thing. Emotional control. Being able to recognize your own emotions and then do something to be able to cope with those emotions. So for some of you who may have been told that you have some difficulties with emotional control, or maybe you recognize that yourself, it could be that that part of the reason that that's hard for you is that requires executive functioning, and you may have an executive functioning deficit. Okay. And in order to be able to do the impulse control and the emotional control, you've got to be able to self-monitor. Okay. Okay. So I talked about sort of executive functioning and trying to put it in really plain terms and maybe put it in ways that maybe apply to you during your life. Now I'll talk a little bit about the two big things that I see when working with people with developmental disabilities as it relates to mental health. And I think for the most part, anxiety and depression are sort of the big two. There are others, but those are the big two. And I wanted to show these two. I'm not going to go into them. But when we talk about sort of what anxiety is or what depression is, anxiety and depression are these big sort of umbrella terms. These are sort of more the more specific terms. And I think what most people think of when they think of anxiety is generalized anxiety disorder. There are more specific ones, but this is a list of some of the anxiety disorders. This is a list of some of the depressive disorders. Again, a lot of us, I think, probably particularly during the pandemic, many Americans were dealing with what we used to call dysthymia, that persistent depressive disorder, and major depressive disorder. Again, there are others, but I just wanted to sort of show what anxiety and depression really breaks down to. Then there's other mental health disorders that I do see in people with developmental disabilities. I'll be honest, some of these are often misdiagnosed, and that's another talk for another day. But obsessive compulsive disorder, post-traumatic stress disorder, bipolar disorder, and personality disorders. Those are others that we do see in people with developmental disabilities, except for maybe the PTSD I'll talk a little bit about. But again, that's another talk for another day. But I did want you just to sort of see those. Okay, so the question that I think for today really is okay, so why do people who have a developmental disability often deal with anxiety and depression? Why is it those two? And I think that one of the main reasons likely is the fact that they're dealing with an executive dysfunction. And just like I was talking about earlier, all of those things that you need to be able to do to navigate your day, if you're struggling with those, it can and will, understandably so, cause anxiety or depression or both. And so I think that there are other reasons too, that anxiety and depression are main ones, but I think all the executive functioning stuff that we've talked about previously is one of the big ones. Okay. There are other ones. For folks who have a developmental disability, socially, they may be more isolated. Again, I'm not telling you all anything I think you don't already know as far as the social stuff. But obviously there can be difficulties in the social world. There can be communication deficits, and not just the verbal communication, not just the language, but the nonverbal communication can be hard, and that can be an impediment to successful social interaction. If you look at studies that have been done on communication, you will see that the vast majority of what encompasses communication is everything except the actual words themselves. You'll see stuff, it's in the 90s. So it's like 94%, 93%, somewhere in there. 93, 94% of all communication actually has nothing to do with the words. It has to do with how loud you talk, how you hold your body when you talk. Do you talk with your hands? Do you talk really fast? Do you talk slow? Do you have, like me, do you have a fairly monotone voice, or does your inflection in your voice go up and down, up and down? There's all this stuff that goes into communication that a lot of people struggle with, but they don't struggle with the words. So I know people who have a developmental disability who have extremely high vocabulary, but that doesn't mean that they are understanding everything that's involved in communication. And if you're not, can that leave you socially isolated? Because, and you'll hear some people talk about sort of particularly in groups, sometimes too one-on-one, but particularly in groups, that there seems to be this hidden understanding amongst people about what the expectations are and what's going on. And there are a lot of people who struggle with that and can't, they know it's there because they can see that everybody else is following it, but they can't figure out what it is or where it's coming from or how it works. And a lot of that is the nonverbal communication stuff. And that can definitely affect your ability to communicate and socialize. Obviously, physical differences can affect your ability to socialize and communicate with people. Yeah, I don't need to go into detail on that, but obviously that can have an impact. Your ability to access things and the barriers that are in your place, sometimes actually physical barriers, but sometimes metaphorical barriers, can help prevent you from getting access to the things that you need to be able to live a full life. That can affect your mental health. It can produce anxiety and depression. Same thing with the lack of supports. And a lot of folks don't have the support that they need. One of those right now, and this may apply to some of you, some of you may not, but just in the developmental disability world in general, right now, there's shortages of everything right now, but the shortage of direct care support staff right now, the shortage of nursing staff right now is so profound that many people are not able to get even basic needs met. And that is having a huge effect on people's mental health. It is contributing to depression. It is contributing to anxiety. And the other thing I think that often it's getting talked about more and more now. But from my professional experience, up until about 7 years ago, we never really talked about this. And that is trauma and how much trauma people with developmental disabilities experience in their life. And sometimes that trauma is big capital T trauma, right? But sometimes, a lot of times actually, it is things that are not these huge traumatic events. They're smaller. They happen frequently, but over time, they can really build up and have an impact. So, for example, medical appointments, right? A lot of folks with developmental disabilities are routinely going to the doctor, to the OT, to the speech therapist, to the counselor, to the intervention specialist. You name it. They may have, and I know plenty of kids. I know some adults too who are constantly back and forth in the hospital, back and forth in the hospital, back and forth in the hospital, back and forth in the hospital. And mentally, that can take a real toll. It also can make you feel different, isolated. For plenty of folks, have the financial means to be able to drive to appointments. Yes, it takes time out of your day, But if you don't have a car and you have to take a bus, or if you can't take a bus and you have to rely on like Medicaid transportation, for any of you who've ever had to deal with it, they give you these humongous windows of time that you're supposed to be ready. So if you've got a 12 noon doctor's appointment and you really need to leave your house at 11:15, they may give you this 2-hour window when they may pick you up, which basically means that most of your morning is spent sitting around and waiting to see when they're going to pick you up, and you have to be available. And then you go to the doctor, and it's the same thing to get picked up and go home. So your appointment may be done at 12:45, but they may not pick you up till 2:45. And by the time you get home, it's 3:30, and your entire day is gone because you have one appointment. How does that affect your ability to hold a job? How does that affect your ability to do well in school? Um, for kids, I know I've seen it many, 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 many times. Schools calling the family and saying, um, your child is truant. They're not coming to school. You're in trouble because you're not sending your kid to school. And parents are saying, well, what, what are you talking about? Well, they've missed so many days and stuff for, and we're like, oh, we have all the documentation, the fact that they are at the hospital seeing their specialist for stuff. But schools automatically send it, they don't even send it, the computer sends it. So parents are getting these phone calls and these emails and these letters saying you're in big trouble because your kid's not going to school. Well, how does that make the parent feel? It makes them feel terrible, and they know it's not their fault. But these things happen. That takes a toll on the parent, and then the parent, understandably, is frustrated, is tired, and sometimes that ends up affecting the child. Um, Parents always try their darndest to make sure that doesn't happen, but it does happen sometimes. So I think we're just as a developmental disability professional community, I think we're much more aware now of the effect that trauma has on folks. And again, I think even just 7 years ago, we really didn't ever talk about it, and I'm really, really glad that we're becoming much, much, much more aware of trauma and how it affects people in their life. Okay. So I want to take a couple of minutes to make sure, do people have any questions about anything that I have talked about thus far?
I think I'd like to hear too. Does this resonate with you? Because boy, the things that I'm hearing, I'm like, yep. I see this in our family. I see it with people that call in. That the frustration just mounts and mounts, and then you just get angry and upset and anxious. And has anybody else had those experiences? Yeah, I see you shaking your head.
I'm gonna say that I kind of I guess identify with the first slide he showed us about executive function, because I feel like I have some of those traits, or whatever you want to call them, too.
So were you talking about this one, or were you talking about this one?
This one, yeah.
This one right here?
Yeah.
So
the think, plan, do, stop.
Yeah.
Yeah, stop, think, plan, do. Yeah. I think that, again, that I was really glad I found that picture, because I thought it so easily explained what can look like a very complex process of your brain. And it is complex, but at the same time, it really is that simple. It really is that simple. Not simple to do, but simple of a concept.
anybody else feel like that, yeah, this is making sense to me. And it's kind of good to know that it's part of my disability and it's not just me. I remember an adult saying that to me one time, like, I had no idea that this was part of Spina Bifida, and I just felt really bad about myself for not being able to get places on time or not be able to keep my stuff organized, or it made me feel stupid. And I'm not stupid, but it just made me feel bad. And it was really enlightening, and it made her feel better that she was like, oh, it's part of that. It's not me, it's my disability.
I think it's yeah. Sorry, go ahead.
Oh no, I think like for me, just like all of this like is something that I know I struggle with, and I think I'm getting ready to. I've been hired on, but I'm getting ready to start a new job, and it does concern me that like I could lose my job because I can't, necessarily do what they're asking me to do as quickly as they're asking me to do it, or because of my executive functioning challenges. And it's like, great, like what am I getting myself into? Am I just setting myself up to get fired because I either have doctor's appointments or I'm functioning maybe not as well as they are expecting me to?
I can't understand what exactly you're talking about because I haven't lived there, right? But I think I do understand a little bit of it in that the things that I'm talking about can make people, when you're thinking about employment, you're thinking, oh man, yeah, these things really do apply to me. And yes, they really could affect my ability to do my job. I will say, however, though, that once we start going forward in this presentation, we are going to start talking about things you can do to be able to help with it. Now, I'm only going to be hitting highlights of things, so I'm not going to be going into like great depth, but I am going to start hitting some highlights of things that I think maybe hopefully would get you thinking about how could you take some of these ideas and apply them in your own life. And then towards the end, we'll talk about sort of what an executive functioning coach is and what they do and how they can help. And that can absolutely include helping stuff on the job. I think it also, and again, we don't have time to go into all this today, but I do think that communicating with your employer what you're comfortable communicating, that you may need some accommodations on things, like you may need, and we'll get into this later, but maybe you need to have certain things written down for you so that you can keep those details of things straight and not confuse them. And employers usually will feel like that's a relatively easy accommodation for them to make, and it won't take them long to make it. And if they give it to you, you will do your job so much better than if you didn't. And usually, employers, if there's a tool out there that they can give their employee that will help them do their job better, a lot of times they will do it. And if it takes a ton of their time or it takes a ton of their money, then maybe they're not apt to do it. But the kinds of things I'm talking about don't really take that much time, and they don't really take that much money.
Yeah, I wanted to share in the chat too that somebody said, yes, this has been very enlightening, that they're really,
I'm glad. I do, just in the essence of time, want to get started again. And so I want to talk a little bit about solutions. Like, so, okay, I've talked about, oh yeah, there's all these executive functioning issues. But then the important part, of course, is, well, what do we do? And I am going to give some very surface level examples of things. I won't have time to go into great detail about them, but it should get you starting to think about some things and how it could apply to you. Okay. So one thing I think that we often overlook is what we call physical organization. And by physical organization, I mean like the placement of things, the organization of furniture, and how it impacts a space. So if you just look at those two pictures that are on the screen, okay, it's relatively about the same size, but just look at how the furniture is and the things that are in there, and look how different it sort of feels. And look at how much easier it is to actually like move about in that space. So I think a lot of times that, particularly for those of you that may have mobility issues, like a lot of times less is more, meaning less is better. And just sort of how you arrange things. And if any of you have ever looked at feng shui or read about feng shui, it's actually very interesting in how sort of the flow of your environment can affect how you feel. I think it's not like you need to go study feng shui, but I think if you Google it and read a little bit about it, you'll see like how it can really affect how an environment feels to you. And again, if you just look at those two pictures, and again, it's about the same size space, but when you would stand in it, I think you would feel differently in those two spaces. At work, before the pandemic, everything was sort of had turned to this communal space where no one had an office and everybody got together in these big spaces. You didn't have an assigned desk, and you just kind of worked, wherever. And I get why people wanted to do that, but I know that people who have executive functioning deficits, people who are easily distracted either by sights or sounds or both, how people would really struggle to get work done in an environment like this. I couldn't do it. There's no way in the world I could do it. I get distracted by visual things, people walking by, things happening. I get distracted by conversations that are going on beside me. I can't sometimes drown out all that noise to be able to focus on the person who's talking to me. So I often have trouble talking to people in crowded environments. And I always thought it was a hearing issue. And I went and got my hearing tested, and they were like, no, your hearing is good. It's an attention issue. You just can't drown out all the other stuff. And so everything is coming in at me at the same time, at the same volume level. And I can't understand what the person is saying who's sitting right next to me. So if you're looking at sort of, environment and the placement of furniture and the way things are arranged at work, might you do better in a setting where there may still be a lot of people around, but maybe there's some visual barriers that help block a lot of that distracting stimuli. Okay. Not everybody's going to be able to have the corner office where you can shut your door and pull the blinds and have that space to yourself. Lots of us are going to be working in an area where there's plenty of other people around. But is there a way you might be able to arrange the furniture such that if you are distracted by other things going around, can you position things so that maybe you don't see it? Or maybe if, again, you're like me, you can't drown out all that other stuff, can you ask your employer about wearing headphones that are noise canceling to help drown out everything else that's going on? And again, those are accommodations that, for the most part, employers are willing to look at. Again, if you're talking about taking the existing desks and file cabinets and stuff that's already there and you're just rearranging it, a lot of employers are going to be open to that. Again, because they're not spending time or money ordering all this new stuff or buying lots of expensive dividers. At home, thinking about finding ways to have some context to your spaces. So, like if you have a home office, or let me take that back. Let's say you're working from home, which a lot of people during the pandemic had to do, and some people are really continuing to do. Where do a lot of people sort of do their work from home? I mean, if you're wealthy enough and you have a big house and you can have a dedicated private office in your home, that's really nice. A lot of us don't have that. But that doesn't mean that you can't utilize some small space and set it up as your sort of home office. And it can be, and in this picture, you can see in the picture, this is sort of a nook. This is sort of a space in a room that's a little funky, but you could put a desk and a chair and a computer in there. And that can sort of be your dedicated workspace. And it does provide that extra context. Like as soon as I sit down in that chair or walk into that nook, like I am at work. I've got this singular thing that I am doing. I'm not sitting at the dining room table with papers all over the place, dirty dishes everywhere. I'm not sitting at the bar in the kitchen. I'm not sitting on the couch with the TV on and getting distracted with everything. It's when it's time for me to work, I go into this nook, this corner of the room, this space, and I focus on work. And when you get into the routine of that, you will find that a lot of times that will help your ability to focus, because your body and your brain will get used to the idea of I'm walking into my office, it's work time. And then when work time's over, you leave and that's done. Okay. So it doesn't have to be this dedicated, beautiful office that's in your house. It can be, a corner of your dining room. It can be a nook. It can be a small spare bedroom. But have it such that that's the only thing that you do. So you're not doing laundry in that workspace. You're not doing dishes in that workspace. You are doing work in that workspace. Okay. Looking at schedules. So, and I'm going to talk about schedules, and I'm going to talk about activity systems, and they're going to look very, very similar, but there is a distinction, and I'll explain that in a minute. So, schedules for many of us, we keep them on our computers or our phones. They're synced together so that if you make a change on one, it automatically appears on the other. These are brilliant tools. You can do things with color coding and all kinds of stuff that can help you sort of keep straight what you have going on. But they don't have to be on a computer. My wife still uses a paper planner, and there's nothing wrong with using a paper planner at all. If it works for you, do it. Okay, so don't feel like you have to have it on your phone, don't have to have it on your computer. And again, there's lots of different ways that you can do it. For some people, it makes sense to have like an hourly planner. For some people, it's a daily planner. For some people, it's a monthly calendar. But whatever you feel like works for you, use it. And by schedule, here's another example. So it doesn't even have to be using a planner. If you feel like you need to have a sort of a written list of what you need to accomplish that morning, then you can do that. It doesn't have to be like this full day kind of a schedule. For some people, having that full day schedule is overwhelming, and they look at it and they're like, oh God, I've got these 9 things on here. That's too much. I'm starting to panic. And so they break it down even smaller into maybe this is just what I'm doing this morning. And that's all they're looking at. Now, when it gets to afternoon, then they'll look at their afternoon schedule. But if they look at them at the same time, it's too much. Okay. There's also activity systems. So the distinction between the two, and the easiest way that I know to sort of remember this is a schedule will tell you where you need to go. And an activity system will tell you what you need to do when you get there. So here's an example. You've got to go to the grocery store, right? So on your schedule, so whether it's in your phone or on paper or whatever, it says go to Kroger, right? So that's your schedule. It tells you where to go. Then when you get to Kroger, you pull out your checklist of the things you need to get while you're there. So milk, eggs, cheese, butter, cream, right? You've got your grocery list, so to speak. Maybe it's on paper, maybe it's an app in your phone, whatever. But the written schedule will tell you where you need to go. I need to go to Kroger. And then the activity system will tell you what you need to do while you're there. I need to get milk, eggs, cheese, butter, cream. Okay. There's many different ways to do schedules and activity systems. And again, I don't have time to go into them today. But if you are interested in more information, I'll give you my contact information at the end of this, and we can kind of talk about ways to be able to implement some of this stuff.
Can we call that a to-do list, Tom?
When you can, because a lot of
absolutely. Yeah, this is what's on my agenda for today.
Absolutely.
No specific time. This is just what I have to get done.
And I think for some, and again, this goes into anything, but for some people, time helps a lot and makes a lot of sense. So like 9 o'clock, I do this, 10 o'clock, I do this, 11 o'clock, I do this. For other people, it doesn't. And having that time on there actually makes it worse. And so you sort of do have to figure out for yourself whether having time on there is beneficial for you or not. Because some people will look at it and be like, oh my God, I got to get this done by 10 o'clock. And it doesn't matter if it really only going to take them 10 minutes. It's just the anxiety of, oh God, I got to get it done by 10 o'clock. So for some people, it may make sense to just not even have time on there. And it's just, I've got to do these 5 things. And then if you happen to get them all done within the first hour, okay, great. And you don't have anything until later in the afternoon. So that's where you sort of have to really individualize things and figure out what works for you. But yes, a to-do list is absolutely what those things are. Okay, organization of materials. So again, if you look at these 2 pictures, there's a very different feel in there. I think one of the nice little sayings that seems to make a lot of sense for folks is a place for everything and everything in its place. Meaning, like, stuff just doesn't go wherever. There's a plan for where things go. Everything's got a home. Everything has a place where it belongs. And then you have to make sure that it always goes back to where it belongs. It goes back home. So there's 2 hard parts to this. One is setting up that there's a place for everything, and you may need help in getting that set up so that everything has a place. But then you may also need help in getting into the routine of putting things back into their place. But the sort of saying a place for everything and everything in its place does make a lot of sense. It does take work. You may need help with it. Again, an executive functioning coach, a professional organizer, folks like that can help with some of those things. You also can look at, we talked about sort of, sometimes less is more. Many people may have, and I forget the woman's name, but the whole having too much stuff and you're supposed to like physically pick it up, and if it doesn't spark joy, you're supposed to get rid of it. I don't know that people need to go that far, but I do think that if you're feeling like your environment at home or your environment at work seems to look a little bit more like the picture on the bottom than it does on the top, then I think maybe you need to think about, how can I take this stuff and how can I have a place for everything, and how can I make sure that everything is in its place? And do I need all this stuff? Because I think sometimes people's anxiety levels, their stress levels, when they go into an environment like the picture on the bottom, their anxiety goes up immediately just by looking at it, versus going into an environment like the picture on the top. And again, I'm not suggesting that it's easy to switch from having your environment like on the bottom to the top, because it's not easy. It takes work. And it doesn't have to happen all in one day either. It can be a progression. But I think people will find that their ability to find things, their ability to remember where things are, will increase if there's a place for everything and everything's in its place. There's also the use of visual instructions. So again, a lot of times for people with DD who have executive functioning deficits, their ability to get things done has zero to do with their intelligence. It has to do with the organization and the prioritization, the sequencing of stuff. And one of the things that folks can do to be able to help with that is to be able to have instructions written down for things. And there's many different ways to be able to do this. There's two examples up on the screen, okay? One is for a child, okay, for bath time, and trying to learn to be more independent in what they need to do in order to take a bath and successfully bathe themselves and be done and do it in a timely fashion, right? So that particular setup is not for an adult. That may be for a child. But the one on the bottom, like maybe having written instructions for things handy, maybe it's on your phone, maybe it's in a notebook, so that, again, it doesn't have anything to do with intelligence. You know how to do those things, but maybe you have a hard time remembering in what order to do them. Or maybe you have trouble remembering little details of things that are important, and having them written down and being able to look at them like as many times as you need to look at them. So if you are a person who gets distracted really easily, having that written and having it right there so that when you forget where you were, you can easily refer to those written instructions and see, okay, this is where I was. And I don't have a picture of it, but things, simple things like on a to-do list, like when you check stuff off or you draw a line through it, it does give you this clear indication of where you are in that process. So that if you do get distracted, you can come back to it and you know, okay, this is where I was, right? You can use visual instructions for particularly, I mean, a lot of stuff at home you can use it for. If you think about if you cook or you bake, recipes, I mean, that's what they are. They're visual instructions. They give you the information on what you need, what materials you need, how much you need, and in what order you got to do stuff. Okay. And so if you can take things like that and think about how could I apply that to this thing at work where my coworker is telling me they're frustrated with me because I'm not getting things done because I'm doing them out of order. Like, what could I do at work? How could I give myself that information so that I can make sure I'm following these steps in the correct order? Like, you know how to do each individual step, but maybe it's just that sequencing. Okay? Or maybe you just get distracted and you can't figure out where you left off. And having those instructions that you can refer to as many times as you need to helps. Also helps increase independence so that you're not having to go back and ask people, like, where was I? What step was I on? Okay, you can sort of do that on your own without having to rely on other people. The other thing is breaking down tasks into smaller steps. And I really like this picture because you can see the person on the left, much smaller steps, but those smaller steps have allowed them to make tremendous progress. And the person on the right can't even get to the first step because it's too high, it's too big. But taking a task and breaking it down into small steps can really help you make progress. Sometimes, you'll have to play around with this, but for a lot of people, those individual steps may be quite small. And it may look like, do I really need to break these steps down into that small of a step? Maybe the answer is yes. And while it may look like I don't need all this, you may find that if you do it and you try it, you may find that you end up making a whole lot more progress because you've broken it down into such small steps, and you're preventing yourself from missing pieces of the puzzle or steps in the ladder. And so really looking at how small do you need to break those down? And I think if you're trying to decide, like, do I break it down into 2 steps or do I break it down into 3? I think you start with 3. And then if you need to, then if you realize, okay, I really don't need it in 3, I can do it in 2. I'd rather people start with success and be able to build on that success than start with frustration and failure, right? I'm willing to bet that many of you have had enough frustration and failure in your life. You don't need any more. So if you're gonna set yourself up for stuff, set yourself up for success. And even if you think, I don't know if I really need that, I think you say, yes, I need that. Start there, experience the success. And then if you realize, okay, I actually really don't need it broken down into that many steps, then you can change it. But you're starting from success and building off success instead of starting with frustration. Okay. If you look at all those things, those examples of things that I talked about that you can do to help with executive functioning issues, if you can do things to set yourself up for being able to do things more independently, you set yourself up to be able to do things and experience success, your mental health symptoms are very likely to decrease. Okay. So in working and doing counseling with people with developmental disabilities over the years, I've talked to many, 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 many people who have gone to therapists who have said, I'm depressed, I'm anxious. And the therapist, understandably so, and I don't blame them, I'm not knocking them because I think they're probably very good therapists, but they tend to focus on the mental health, the depression, the anxiety, and sort of address it. But those are just symptoms. Those aren't the problem. And I think that's the difference in supporting people with developmental disabilities is we need to look at what's causing them. And a lot of it is the lack of independence, the lack of success. And whether that's success at home, whether that's success at work, whether that's success in relationships, wherever. I think if you can put things in place that will help build your independence and start you off with some success, your depression symptoms may well get better. Your anxiety symptoms may well get better. And I think that's where, again, traditional counselors, therapists, I think they're good. I think they probably do fantastic work. But I think they miss the developmental disability piece. I think they miss the executive functioning piece. And I think a lot of times it helps your mental health if you can look at addressing those other things. And then if those are addressed, then yes, there may still be some depression issues and anxiety issues, and maybe there are some things you can do to address those more directly, right? I think going to counseling and talk therapy, traditional talk therapy, can be beneficial. I think a lot of times therapists will want folks to go through CBT, which is cognitive behavioral therapy. And if anybody's ever gone through cognitive behavioral therapy, the whole point of it is to try to help you learn to change your patterns of thinking, right? To change how you think. Many people who have a developmental disability don't like change. And so you're talking to, because I think changing anyone, changing their behavior is really, really hard. Okay. If you've ever gone through CBT, it's hard. So anyone is going to have a hard time changing their pattern of thinking. But if you add on the fact that you're a person who doesn't like change, now it's even harder. And so I think CBT sometimes can be very, very, very frustrating for folks with developmental disabilities, because it's requiring you to do this thing that you have a deficit in. You can still do CBT, but I do think it can be adjusted and tailored for your individual needs. But I think for a lot of people, DD-CBT isn't probably the best method. I do think that therapists who are have gone through trauma-informed care training, that can be extremely beneficial, as we talked about with some folks who are dealing with a lot of trauma over the years. Having somebody who's educated and informed on trauma, I think, can really, really help. That can help with anxiety and depression. I think psychoeducation, like learning more about whether it's spina bifida, whether it's intellectual disability, whether it's autism, whatever it is, the more you learn about it and how it affects you, not just emotionally, not just physically, but like how you actually think and learn and process information. If you can learn that about yourself, and Diane even mentioned this, like, oh, that's why I do this, or that's why I struggle with that. Like just knowing that can help with anxiety and depression, because it's an answer and it makes sense. Like, oh, there's the explanation. Now I understand why. Okay. There also are executive functioning coaches. And my understanding of executive functioning coaching is that in Cincinnati, for whatever reason, this hasn't caught on a whole lot. There are people in Cincinnati who do executive functioning coaching. So if you Google it, you will find some folks that do it. There is, and I didn't put her information on here, but there's a woman named Jennifer Wells, and it's Wells, Jennifer Wells. She's an executive functioning coach, and she works with a lot of people who are what a lot of people call twice exceptional, meaning cognitively very intelligent, but also may have a neurodiverse diagnosis, ADHD, autism, whatever. And that's sort of her niche. So if you're thinking of, well, maybe I should reach out to somebody who sort of does this and can teach me more about this stuff, Jennifer Wells is a good place to start. But there are other places in Cincinnati that do it. If you Google it, it is, I think, the downside with some of it is that it costs money, just like everything else. It can get expensive. But I do think that may end up being a very worthwhile financial investment for you if perhaps maybe you get 20% better at your job. Maybe you get 20% more productive in your job. Maybe that's enough to get you to a point where you get a pay raise. Maybe that's enough to where you're doing well enough to get a promotion, and that money ends up sort of paying for itself. I think, I do some of that. I do elements of it. I think, somebody like Jennifer really specializes in that stuff. But I do some of it too. So if people are interested in learning more, they can reach out to me. My phone number and my email address are right there. I also do have a website, so if you just Google Galperin Autism Consulting, you'll find it. I think I covered a ton of information, and we've been talking for like an hour and 20 minutes. So I want to stop there because I want to make sure that if people do have questions or comments or whatever, that they have an opportunity to be able to ask those or talk about those. Okay.
I did want to back up a couple slides, Tom. You said the one that had independence and success. I think I just wanted to clarify for folks, independence doesn't mean being able to live independently or do everything for yourself, but I think being able to direct things so that you're making your own choices and that things are going the way that you choose. Am I correct there?
Oh, yeah, you're absolutely correct. I appreciate you clarifying that. I hadn't thought of it when I was making this slide. I hadn't thought of it in that way, but what you're saying makes absolute sense. Yes.
Any thoughts, anybody?
I have a comment. I had talked to my doctor about depression because I was having some symptoms that a family member noticed in me. And so anyway, and okay, so I was having these symptoms, and it was a lot of symptoms of executive dysfunction. So I'm thinking now that my depression was more, or these symptoms were pointing more towards executive dysfunction, not necessarily depression. So it was very enlightening to see this presentation. So.
Good. It's exactly what I had hoped might happen. And it is very possible that maybe you are dealing with depression, but the reason that you're dealing with it may well have to do with the executive functioning deficits.
Mm-hmm.
And so instead of, not that you shouldn't address the depression, because you should, but I think how you address it, maybe it's more about how can you help with the executive functioning deficits than it is about how do you tackle the depression.
Mm-hmm.
So,
okay.
I'm not a doctor. I don't prescribe medicine. I've never been to medical school. But I do know that antidepressants don't work for everybody. I do know that a lot of people don't need them. What they need is some other things. I think, unfortunately, particularly in America, but in lots of other places too, the solution is always take this pill. And I don't think that's always the best solution. Now, I say that, but also for a lot of people, yes, medication does make a huge difference. And yes, antidepressants have made a huge positive impact on people's lives. So I'm not anti-medication, I'm not antidepressant. But I do think that there are lots of other things that people can do that will help just as much, maybe even if not more, right? So if you are already on an antidepressant and your doctor is saying, well, we're going to put you on this second one, you should listen to them. But I think you also should say, is there something else we could try instead first and see if maybe that helps? And then if it doesn't, then maybe we talk about that second pill. But I preface that with the fact that I'm not a doctor. I don't prescribe medicine. I've never been to medical school. But again, I do know enough to know that a pill isn't always the answer.
I suspect too that it builds on itself. Like you have the executive dysfunction, which causes, as you just discussed, the depression and anxiety, which then makes the executive dysfunction worse, which then increases the depression and anxiety. So being able to kind of put a halt to that and step it back by putting some things in place.
Yes, I think it has been a vicious cycle.
Mm-hmm. Yes. Yeah, and I didn't talk about that, but then you're absolutely right. Anxiety and depression both impact your executive functioning skills. So yeah, that is a vicious cycle.
Does anybody else have any questions or comments or things to share? We're just at about 4:30, and I think we're all about ready for a break. I know I'm ready to move around a little bit. So, Tom, thank you so much. I think you've given us a lot to think about, and also, in some cases, like a feeling of acknowledgement that, all right, I get this, and I have a better understanding of why things are going the way they are for me. So I appreciate that.
Well, I appreciate you having me come. So thank you. And like I said, if anybody wants to reach out to me, my phone number, my email address are right there, and people are more than welcome to do that.